Premed office hours. I'm plugging in my phone. Episode 164. My name is Dr. Ryan Gray, your moderator for the day. I've written some books. I host some podcasts. I started the medical school HQ and co-founded Mapped. All around pretty cool guy, I think. I am joined by some even cooler people. Dina Golini.
Well, she definitely
former
I don't know about that, but
former senior admissions
cool.
Officer. We need to change that. Admissions officer for
right.
Stanford School of Medicine and former assistant director of advising at Brown University's Alpert Medical School. How you doing, my friend?
I'm doing well. How about you?
I am excellent. This is one of my favorite
Good.
hours
Happy to
of
be
the
here.
week. Yeah, I get to hang out with you all. I get to help some pre-meds, answer some questions, share some knowledge. And today we're going to share some free tickets to MappedCon as well. So stay tuned for that. Also here, Rachel Grubbs, co-founder at Mapped, MCAT, pre-med expert for 20 or so years. How you doing, my friend?
I'm very well. I'm always excited to be here at Premed Office Hours. This is a fun hour of the week.
Oh, yeah. Oh, yeah. For our friends watching on Instagram right now, go over to premed.tv, which is our YouTube channel, where you can ask your questions. I will not be glancing at my phone over here on the side to see what you all are asking. So, MappedCon.com. I mentioned MappedCon just a second ago. It is our pre-health conference presented by Blueprint MCAT, and it is October 6th through 8th in Baltimore, Maryland. It is live and in person. We have a ton of exhibitors and sponsors. You can go check them out right now. MappedCon.com. Click on that exhibitor menu item and see the full list of medical schools and post-bac programs, S&P programs, test prep programs, all kinds of amazing fun stuff there for you to go and interact with those schools. And if you go and listen to episode 537 of the Premed years, you'll learn how going to MappedCon and conferences like it will help improve your chances of getting into med school, because you can go interact with these schools that are out there actively recruiting you. So go check out that podcast episode and go get your tickets at mappedcon.com, and stay tuned till the end of Premed Office Hours today, and we'll give away some tickets as well.
What was that episode number again, Ryan?
537.
537. All right.
Yes. With Dr. Joanne Snap from My Honest Advisor. I had her on 437 and again on 537, and I told her we're going to have to just continue that trend and have her on at 637.
I mean, 37 is one of my favorite numbers. I am partial to prime numbers. I love that Joanne gets that slot.
All right. All right, let's rock and roll. So again, we'll take your questions at premed.tv, and let's rock and roll. Our first question from if I spent 90 hours getting a phlebotomy certificate, can I add that to all the hours I spent working as one in the activity section? Rachel, this question comes up a ton, the certificate. And if I work as a phlebotomist, does my training as a phlebotomist count as clinical experience if I'm going to add those hours together?
Yeah, my vote is no. Generally, I don't think getting the training, getting the certificate should count as an activity, because that's an education component. And, you know, the section is called activities, sometimes accomplishments, experiences, but it is sometimes also referred to as extracurriculars. So I think of it as what's outside of school. Now, the pushback that sometimes we get is, oh, but my phlebotomy certificate or my EMT certificate had a lot of on-the-job training, and that's why I'm trying to make the case that some of it should be clinical. I think, you know, the challenge is that if you're in school, you're having supervisors, there's a bigger understanding of being able to make mistakes and learn. So what I would argue is, no, do not list the certificate. Go get a phlebotomy job or a phlebotomy volunteer activity and count those hours.
There you go. Yeah, especially the certificate, right? The training, a lot of that is going to be just book knowledge and not necessarily true clinical experience. Although while getting your certificate, you're probably getting clinical as well. But just count the hours that you're working. All right, good first question. One of these days we'll get that "is it clinical" button working and website kind of question up. But yeah,
it works. It just takes you to a landing page. Doesn't do anything cool other than say, "Hey, coming soon."
Yep. All right, what else we got? Sebastian, not a question, but wanted to give a shout out. I got 3 interviews so far and couldn't do it without you all. There we go.
I love to see this. I mean, I always love this feedback. But Sebastian, I remember your name. You've been a regular attendee of these sessions, so I feel like I've been with you on this journey. So awesome. Thank you for sharing the good news.
Congrats.
Yeah. So one of the core missions that we have is providing as much information for free as possible. And I think Sebastian is a good potential example of that. All right. TBR R16 is being a volunteer crisis counselor for the crisis text line considered clinical or non-clinical. Will med schools look at this activity negatively since it's virtual? Dina, so pre-COVID, I don't think crisis text hotlines was on anyone's bingo card for clinical experience.
Right.
And then COVID happened, and you're like, well, why not, right? If doctors are doing clinical interacting through like their electronic medical record answering patient questions, why not this? What are your thoughts?
Yeah, we get this. I mean, even in Premed office hours, this question comes up a lot, right? Maybe like every other session. And you're right. Being a volunteer crisis counselor was not a thing really before COVID. And in that respect, it became a very popular activity for pre-meds, pre-dental students, pre-med students. So, I mean, in my time reading applications at Stanford, I would say I saw this probably 8 out of 10 applications, if that gives you any sort of reference as to how popular it is and how it really doesn't stand out that much. To me, I mean, there are aspects that could be clinical in terms of providing any sort of like mental health counseling or things like that, but I don't think it's clinical. I think it's volunteering. I don't know if Rachel would disagree with me or agree with me. I also think it's just, if you're looking for this to be your only clinical experience, it can't be. You need more direct in-person patient care. So the key here is, remember, it's virtual, right? So.
Yeah, and ultimately, like so many of these questions, it's going to depend on the specific school, the specific AdCom reader. So almost whether or not I agree, it's like that's still just 2 out of 2,000 possible votes, right? It does seem to me from the conversations that I've had at conferences or, listening to Ryan doing podcasts with people or, sometimes we get some professional development where we get to talk to deans at advisor specific events, that the trend of virtual is fading, right? So not just for this volunteer text, but also for shadowing. There was a year or 2 where there was a lot more tolerance for it. And it seems like that tolerance is going back down. So is e-shadowing or virtual shadowing bad? No. But like you said, with this crisis text line, I don't think it's enough. At this point, there's an expectation that there's substantial in real life experience. So if you're using some virtual to supplement, that's great. If you're a night owl and you want to do crisis text line, like people, they desperately need help in that 10 a.m. to 2 p.m. window, right? So if you've got that energy and the bandwidth to do it, it's a lovely thing to do. It's just not going to be your most meaningful clinical experience, probably.
Yep. Trey asks, how soon should we start seeing interview invites and when should we start to worry? Oh, the worry train is about to depart.
It's departed.
It's departed. It leaves every 30 seconds.
Yeah.
It is an express train to Crazy Town. Dina, this question comes up all the time about just kind of the standard timeline. And I think this year we've seen an acceleration of the timeline, especially among DO schools. I'm not sure why. I mean, I have some assumptions. I'll leave them to myself. But DO schools started handing out interviews super early, followed by Texas and MD schools as well. For Trey and all of the other overthinking pre-med students out there, when should they start to worry? And I would just, I'll answer the first part, right? We're seeing interviews now, but when should they start to worry?
I know everybody's worried, right? And part of this worriness comes from maybe being on Student Doctor Network and Reddit and seeing other people get interviews. I think that it adds a lot of stress, but schools are releasing interviews already. Interviews have happened in the past few weeks and are happening. And don't have it be something that discourages you, because on the back end of things, in terms of on the admission side, there's so much going on. It's factory going on. It's like an admissions factory, and there's just like queues of thousands of applications, and there's so many different readers, and it's just it could just be that you haven't been evaluated yet, right? And a certain number of applications have been evaluated enough where they could proceed with dispersing interview invites. So it doesn't necessarily mean that you won't get an interview. Most schools are rolling admission, and you have to be patient. I would say come the fall, if you submitted on time, like when AMCAS opened and you got all your secondaries in pretty much before now, come October, November, if you haven't heard anything, then that's the time where you really want to start to advocate for yourself for any schools that accept update letters. You want to start to, formulate a list of who will accept it and really start to update schools on what you've done since you've applied, and try to hammer home how interested you are in receiving an interview and being considered. However, please know, there are schools that will send out interview invites in, January, February. So It could be a long process, I think.
Mm-hmm. Yes.
Yeah.
Waiting.
I don't know
the
if it was
worry
last
train
cycle.
turns into the waiting train.
I don't know if it was last cycle or the cycle before. There was an interview invite that went out in April. I was like, oh, that school's scrambling. So they did some miscalculations with their enrollment.
Yield.
So.
Yeah. We also 2 cycles ago knew someone who got off 2 different wait lists the first week of July. I mean, amazing enough to get off one.
I know someone that got off one on July 26th. This year.
Wow.
So anything can happen.
Yeah, and so Trey, I think for you, when should we start to worry? It's hard not to worry even now, but I agree with what Dina said about November as kind of a good marker. I do think, even though that feels very early, even though I want people to keep hope alive in the winter and spring, I think November is about the time you start to think about what could I have done better, so that you have time to fix it before May.
Mm-hmm.
Good point.
All right. Zep this. Should I worry about not having my personal statement finished yet and application submitted yet? Should I get my application sent earlier or try to make it better but sent later? So as we're recording this, as we're looking at this question and answering it, it is mid-August. It is August 16th. Rachel, most medical schools in this country have rolling admissions, and they basically operate on a first come, first review process. Interview slots are limited. Acceptances are limited. Zepthys is, I think, trapped in that analysis, paralysis by analysis, and perfectionism of always something to tweak in a personal statement is my guess.
Yeah.
What should they do?
So I'm going to start with some wisdom, Zepthys, which is, what's the best time to plant a tree 20 years ago? What's the second best time? Today. It does get tricky, like Ryan said, with many med schools have rolling admissions. Almost all med schools have rolling applications. The distinction being some schools are actually making offers throughout the fall and winter. Some schools are doing interviews throughout the fall and winter and make all of their offers at the same time. But either way, the earlier you apply, the more likely you're to get an interview because there's more interview seats open, right? The number of interview seats is constantly going down. So if you still intend to apply this year, you got to pull that trigger really soon. Because what you need to think about, and the reason I'm not just giving you a firm yes, no answer here is, I don't know the rest of your situation. Maybe you're really stuck on your personal statement, but you've already pre-written all your secondaries. Or maybe you're going, no, I didn't even really think about secondaries, and you haven't done the math on the fact that if you're applying to, say, 15 schools, you might have 75 or 100 more essays to do. A lot of people apply to 20 or 25 schools. It just keeps going up, right? I don't know if your MCAT's done or not. So what I can't tell you is, are you in great shape to apply? My quick rule of thumb is June is excellent. July is still fine. And by August, I think you're really pushing it. And it helps if your stats are really stellar. I have seen people apply in August and get into med school. I've seen people apply in September and get into med school. But at this point, I think you have to either make it happen right away or consider if the application sent earlier isn't doing it right now, but doing a do-over and getting it right next cycle where you're applying as early as you can in June. So I'm not going to tell you what to do, but I'm going to tell you to ask yourself some tough questions.
Yeah, I don't have my my iPad down here to pull up my fun little chart that shows really at the end of the day, this is a risk-benefit equation. And knowing that the earlier that you apply because of rolling admissions, the theoretical better chance that you have of getting into school because there are more seats available for interviews and more seats available for acceptances. And the later that goes on in the cycle, the more that goes down. And I've always called it kind of a way to help students really understand this. We've usually all played musical chairs growing up, right? Where the number of chairs available is always n-1, where n is the number of players and there's one less seat available than the number of players. Applying to medical school is kind of like musical chairs, a giant game of musical chairs, but instead of n-1, it's n plus and then minus a lot more, right? There are more and more and more applications being verified every single day because a lot of students really don't understand rolling admissions. It's something I wish schools were more transparent about. I wish we got rid of this language about deadlines because I think it's doing a huge disservice to students who don't really understand the process. And that's why we're here every week and doing podcasts and all this fun stuff to try to help students understand this. There's more and more and more students applying, playing the game of musical chairs. And as schools are handing out interview invites, as schools are starting to offer seats, that number is going down. And so you just have a growing difference between number of people who want to get into school and number of potential opportunities to get into school the longer that you go through the cycle. JB asks, thank you, Mapped. Without an E, we couldn't afford it. I am up to 5 DO and 1 MD interview invite. I could not have done it without you all.
It's amazing. It's so awesome. 6 already. It's August 18th. Wow.
My first in-person interview is on Friday. Any tips for nailing the in-person interview or hidden rules? Ooh, hidden rules. Dina, I wouldn't say they're hidden, but there are some pretty good rules out there, like treat everyone well, right? For an in-person interview. What types of advice do you have for JB here? Potentially even squeezing in a mock interview tomorrow with one of our team members.
Yeah, I definitely, well, it looks like the interview's on Friday, right? So it's in person. Definitely participating in some mock interviews, practicing, the language needed, competencies needed, different types of questions, depending on what type of interview it is. Is it MMI? Is it one-to-one? Is it open file, closed file? Practice, practice, practice. In terms of hidden rules, just, like Dr. Gray said, be kind to everyone, be friendly, be approachable, be on time, figure out where you're going. If it's an in-person interview, please do not be late. Maybe look at a map of the campus or the building prior to Friday. If they have some sort of social event, which most interviews are accompanied by some sort of student social, definitely, it's always optional, but don't have it be optional. You want to engage, because sometimes some of those student ambassadors could be, sitting on admissions committees, because a lot of admission committees have, M3s, M4s who sit on the committee as well. So you always want to engage and ask questions and just learn about what the other students are like in case you end up getting accepted and matriculating there. But just be present. Don't be on your phone all the time. If you're in, if the dean is doing a talk or you're learning about the curriculum in person and you're in an auditorium, don't have your phone out and, be on, TikTok or something. Just be present.
What if they're watching our stuff, Dina?
They could do that later.
Oh man, I suppose. All right. Yes, and we have our biggest sale on mock interviews happening right now, JB. Let me go see if I'm gonna go see if we can. Just go to medicalschoolhq.net/advising. That's the easiest, shortest link to go to. I'm going to see if we have any interview slots available for tomorrow. We can bring up the next question too.
Yeah. At the moment we don't, but we could maybe change that.
Elvis is in the building. No, he's left the building. If I retake some allot classes in college, does it look bad in my transcript? Rachel, what? I don't understand.
I'm queen of typos, so I bet Elvis was debating between some and a lot and just left them both in because he was organizing his thoughts. I'm only guessing that because that's the kind of thing I do, Elvis. Your mileage may vary. It's not great to have to retake a lot of classes, right? Because it means that something wasn't going right the first time you took them. That said, I'd rather see you retake classes and get better grades than not retake them, right? So I guess my point sort of is like, what's the alternative? I can't tell if you're asking me this as a freshman thinking, I know I'm going to party a lot this year. Is it going to matter if I get some C's and D's? Or if you already got some C's, D's, W's, and F's and you're going, now what? Right? And if you're in the second boat, well, your choices are either to not take those classes or take them. And if they are courses that are required by med schools will not accept C- or lower for prerequisites. So, you obviously need to get a degree. You need to do whatever your school says to pass those classes, your undergraduate school. But then in addition, there are certain courses that med schools expect. And when they expect them to be taken, they expect a grade of a C or higher. So no C-, no D, no F, no W. So if you're planning to attend a med school and you took some classes that are prerequisites, your first year biology, your gen chem, your orgo, your physics, some of your English and writing, stats, biochem, there's a kind of long list. If you have C- or lower in any of those and you still want to go to med school, then yes, you absolutely need to retake them. And then what you also need to think about, and this isn't what you asked, but just to kind of give you more than you're looking at is, well, does it look bad in my transcript? Again, it's not great. How do you make it less bad? Get your grades up and keep them up, right? Show the med schools that you are a different student today than you were last year or whenever you made those mistakes. And if you're thinking, well, I don't know if I'm a different student, good. Take some time, reflect. What did you do wrong? Are you taking too many courses? Maybe you have to work while putting yourself through school, so you were busy with work. Maybe you moved away from home for the first time and you didn't realize how much support your parents offered you in terms of offering homework structure, right? Like, not that they were doing your homework, but supporting you in doing your homework. You need to ask yourself some tough questions about How did I manage my time? How did I manage my workload? Am I taking advantage of every single thing that my school offers me, right? Your tuition probably includes office hours, asking questions of the TAs. Sometimes there's a study center or a math lab. Sometimes there's free peer tutoring. Sometimes there's low-cost grad student tutoring. There's free stuff on Khan and YouTube. You only asked me, what if I retake? But my point is, what are you going to do to retake and show med schools and show yourself that you are ready for the rigor of med school? Because that's why A's and B's matter. Not because of some number on a paper, but because med school's only going to be 5, 10, 20x times harder. So you need to kill it in college to show them that you can survive med school. So good luck and get that upward trend.
Yeah. All right. Little KJ 1999, what is your opinion on Casper, the friendly ghost? Do you think it's necessary? Is the AAMC preview the better option? Which one holds more value? Oh, I love this question, Dina. Casper, for those who don't know, is a situational judgment test created by our good friends at Acuity Insights, formerly Altus Assessments, formerly something else even before that. They've changed their names a few times. And it is a test where you have both written answers and video answers talking about different situational situations that you're in. Very similar to the multiple mini interview. They are similar because they are both created by the same people. The friendly Canadians up north who have too much time in their hands during the cold winters sit inside and think of all of these crazy ways to torture. So, and the AAMC preview supposedly has been in the works for many, 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 many years and just came out. And it is also a situational judgment test, but is scored on a Likert scale where you have to pick the answer. You don't get the opportunity to talk about your reasoning behind your answers, which for me completely defeats the purpose of a situational judgment test, where I can give you my rationale, my thought process based on who I am, based on my life experiences. And so, Dina, which one holds more value? Can we answer that, since some medical schools want Casper, some want preview? We don't know how they're using them.
Yeah, I mean, I don't think we can answer that. I think, do you think it's necessary as part of the question here? And it doesn't really matter what we think. If a school is requiring it, then you have to submit it. And which one holds more value? I don't know if I can answer that question. Keep in mind, for Casper, there are some schools that will require the other part of it, which is the duet, I think, right, Ryan?
Yep.
Yeah, so I've had a few students that have, planned to apply to a school knowing that they accept Casper, and then come to find out they want that other part of it, and it's kind of held them back with their application. So just my advice is to just, look up what the requirements are for each school.
Yep. Yeah, and the big issue is we don't know how they're using it, right? Are they using it for research purposes? Are they using it? They're hopefully not using it to screen out. Altus is very clear that they don't think Casper should be a screening tool, but that doesn't mean schools can't. Yeah. Sarah asks, what updates do schools consider great and will make me stand out? The wonderful stand out question. Rachel, updates aren't always wanted, right? Some medical schools want them, accept them, and many say, leave us alone, kid. You're bothering us.
Right. Yeah, so I think maybe, Sarah, this question might have come out of the earlier comment. Someone had asked about when should I worry, and Dina had said November might be a time to do letters of interest or updates, which we agree with. Sometimes that does help, but proceed with caution. So number one is you should be doing extensive research about all the schools that you're applying to And if we're talking specifically about updates, where I mean, you've already submitted your primary and your secondaries, and now you feel like, well, I didn't get an interview yet, and I want to reach out to them. The number one question is, do they even accept updates? Because some of them are going to say no. And then the thing that you have to ask yourself is the update, hey, I just really want to go to your school, or I really want to be a doctor, in which case you got to sit on your hands, friend. That's not an update. Or is the update, hey, when I sent my application, I had some clinical, but I've been lucky to get an amazing opportunity. And I've been doing this new clinical job 30 hours a week, and I've had all these experiences, and I want to share a little of that with you, right? Is it an update that would significantly change the way they look at you? And the reason I'm asking that is so often when people say they have updates, what it turns out is they just got an opportunity. Well, you don't have anything to say about that opportunity yet, right? So I find a lot of times when people think they need updates, they don't. But if you do, it should be substantial, and it should be short, and it should be kind of neutral to positive in tone, right? But yeah, a quick rule of thumb that I've heard from some directors of admissions is don't make me scroll. So sometimes people are like, oh, so is a page too long? I'm like, more than a paragraph is maybe too long. Like, really, like, don't make them scroll.
Yeah. Kashik, do med schools see minors as a big boost, or should I just focus more on GPA and MCAT, thinking of minoring in healthcare management, but not sure if it is worth it? Dina, students are always looking for an edge. They're always looking for the X factor we've talked about before, which I'm not a believer in. Minors, double majors, do they help at all?
I mean, let's look at the facts here. At some colleges, you automatically earn a minor by taking, a certain number of, if you were a bio major, and it's also required you take a certain number of chem classes, you automatically get a minor, right? So for some schools, it's not even something that you have to work towards or earn separately outside of your curriculum. It's never going to really give you a big boost unless you do something where you really demonstrate that you've expanded your knowledge and experiences with it. So for example, let's say you minor in public policy and you are really, or healthcare policy, and you are really passionate about, across the country, changing menstrual hygiene laws state to state, where you're putting free menstrual products into high schools and public college campuses, and you helped get laws passed. Then, right, you've utilized that minor towards something active, or a global health minor, or Spanish minor, where you've traveled abroad and worked with underserved populations, and it really helps supplement everything else in some way. But to give you a big boost, not really. Yes.
Yeah. I like to go super hyperbolic, shocker, with this type of question, and just sit there and imagine, right? Dina, you're sitting reviewing applications for Stanford last year, and you have an application come across your desk, and it's Kashik's here, and you go, oh my gosh, Kashik has a minor in healthcare management. I've never seen that before. This is the thing that we've wanted.
Let them in.
Yeah. Right. And it's just obviously I'm not making fun, Kashik. I'm just going super hyperbolic. When students ask this type of question, you have to imagine, right? Put yourself in the shoes of this reviewer who's seen hundreds and thousands of applications. There's nothing in an application that almost nothing, right? That they're going to come across that is oh my gosh, I've never seen this before. Oh my gosh, this is the one thing we need. Oh my gosh. Right. It's the story. It's the reading. It's seeing who you are and the impact that you had on all of this stuff. Yeah. And so if you're minoring in healthcare management, it's something you're passionate about, go do something out in the community or at a hospital where you're pounded on my tripod, where you're volunteering, you're actively doing healthcare management, and you're showing your impact in this field.
Yes.
That's where you stand out.
Yeah, definitely.
I agree.
100%. I think it's such a common mistake to think that school will fix all your woes, because pre-med's I'm generalizing, but generally you lot of really great students. Even those of you who have been struggling with college STEM are still really fantastic students in the grand scheme of everyone in academia, right? Because you're struggling because you're in super rigorous courses. But putting that into action is so important. And, you know, I see a lot of people who when schools and secondaries ask them, like, how are you going to help make a difference in the world? How are you going to contribute? They think it has to be like a global fix, and they often fall back on education, which is maybe because that's what you like. So that I'll put out a newsletter about nutrition. I'm like, okay, do you want to refer back to the thousands of studies that show that people who are undernutritioned are either usually in food deserts where it doesn't matter what they know, or they have emotional problems that are causing them to eat poorly, right? Knowledge is almost never a factor in nutrition in this country, right? So what I want to know is, what are you going to go do? Are you going to go be part of an overeating anonymous group? Are you going to go work with people with EDs, right? Like, put it into action. That's what is, again, not necessarily make you stand out, but show us that you actually care about it. We already know you're good at school. We don't need more proof you're good at school. Go show me how you live your life. Just want to jump on the bandwagon.
Hey. Welcome aboard.
The train.
Departing soon for Crazy Town. Luis. Hey, Ryan and Dina and Rachel. I know this answer is different for each school, but I wanted to ask.
Thanks.
You're welcome. So just let me derail. And Luis, I know there was no harm meant in this, but it's a very common thing for women not to be recognized. So as you are going through this process, when you have your in-person interviews, recognize the men, recognize the women, recognize everyone in the room, and you will do better for that. I know this answer is different for each school, but I wanted to ask, how long can I expect to receive an interview invite after submitting my secondaries? So we've kind of already answered this, right? Again, there's no answer here, unfortunately. There's no, I wish schools were friendly and we're like, hey, you submit a secondary, we have this kind of turnaround time to process it, and you'll either hear yes or no. Unfortunately, most schools will just ghost you. They won't say anything. They won't invite you for an interview. They won't reject you. They'll just never speak to you again. They'll say, they don't even say thank you for the money. So Luis, you just have to play the waiting game. It's the hardest part of this process. Burrell. Any tips on how to get shadowing experience? Thank you. Yeah, so for those who don't know, we stopped our e-shadowing August 1st. It's time to try to get back in person. And so we thought the utility of virtual shadowing was going down and down. Rachel, shadowing is one of the hardest things out there. We had a project called Find Shadowing that never took off because physicians are busy and they don't want to take away time from patients and charting and life, unfortunately. What are your recommendations for Burrell, something?
Quickly, if I were in control of the way this worked, since all pre-meds need shadowing, I would say all physicians have to offer a certain amount of shadowing annually. But I'm not in control of that. So since that doesn't happen, rule number 1 is be prepared to ask a bajillion people and get a bajillion no's, because you only need one yes. I used to start with doctors you know, and I would get a lot of, I don't know any doctors. And I'm like, so you've never been to a doctor in your entire life? And they're like, oh, you mean I can ask my doctor? Yeah, I do think childhood pediatrician, even if you don't go to them anymore. Whoever is doing your healthcare now, maybe on campus, maybe at home, ask any doctor, specialist, or family medicine that you've met they're probably more likely to say yes because they've met you. Obviously, someone you've seen repeatedly over the years, it's going to help more. But start with that because that's often the easiest way. It does help, I think, if you get HIPAA certification. You can Google Red Cross HIPAA certification. Show them that you understand the sensitivity and the privacy laws, and that because often they're going to say, oh, we can't for privacy reasons. So help them make it easier to say yes to you by having that training and that certification. So if you've tried people and that doesn't work, and you've tried knocking on 1,000 doors, just cold calling, and that doesn't work, the next thing is you need to get clinical anyway, Beryl. Please tell us how to say your name for future reference. I assume it's like the green gem that we're talking about is your name, but I don't know how to say that. Anyway, you have to get clinical anyway. So maybe what you should do instead of focusing on shadow is focusing on getting clinical, right? Go get a volunteer or a paid job where you're getting hands-on patient care. You also need that. That's part of you confirming your desire to be a physician. Once you're there, you may meet some physicians, and then you can ask them, hey, could I come back someday when it's not my volunteer shift or my paid shift and observe you for 4 hours or 8 hours? And that might be the way you get shadowing, is by getting clinical first.
I have one more suggestion, if anyone's open
Yeah.
to. Yeah. If you're affiliated with a university, so if you're still an undergraduate or recently graduated, another great way is to try to contact any physicians that are affiliated with your university's hospital system. So if you conducted research, say in microbiology as an undergrad, maybe try to find any other physicians affiliated with the hospital system that have done similar research and reach out to them, because you all have that that thread of being tied to the same institution.
Great point.
All right. Awesome. Chelsea, also, as a newbie in my pre-med journey as a career changer, does MSHQ provide one-on-one advising with students early on in their journey? We do. So we have several advising options. The easiest, quickest is just a one-time call with us, just for 30 minutes or 60 minutes. Share your life story, and we can help you figure out what those next steps look like. We have what we call Premed Pathway, which is set up kind of in terms of a traditional student, where it's freshman pathway, sophomore pathway, junior pathway. But you could theoretically use that in a similar way as well, where it's like, hey, I'm 3 years out from applying, 2 years out from applying, 1 year out from applying. That's generally how it's set up, where you get access to us for an hour every semester, or 2 half hours every semester, potentially a little bit more if you want. And we can be your pre-med advisor through this process. So we have lots of options. And then the third option is go and check out mappd.com, mappd.com, and sign up for Mappd Pro. That is the most economical way to get some advising, where you can chat with us, chat with our advisor. So it's not a one-on-one call, but it's chatting through our platform, where you can enter all of your grades and courses and activities and all of that fun stuff. And we can advise you through the platform. Lots of ways for us to help you. Or you just hang out with us every Wednesday and read our books and listen to our podcasts, all that fun stuff.
Many choices.
Yes. Michaela, how can nurses discuss why medicine without accidentally putting down the NP route? I want to steer clear of that issue at all costs, and have heard mixed tips. Dina, have you reviewed applications from prior other healthcare fields, NPs, PAs, nurses, navigating that journey of why physician versus those other things?
Yes, nurses, pharmacists, a lot of pharmacists, a lot of nurse practitioners, engineers, not that that's healthcare, but there are a lot of biomed engineers. So yeah, I mean, I think it always has to be compelling, right? But with an admissions hat on, I probably would ask, why not an MP? So I definitely would try to make those distinctions for your own benefit. Look up, the differences, really try to highlight that in your application. Maybe try to also highlight any aspects of academic medicine and research that you feel as though you can't get going down the route of, nursing and an MP, highlighting like patient care. As a nurse, you have direct patient care, and maybe any sort of collaboration and work that you've done with physicians and any who have mentored you, and making sure that you've just gotten that experience you need, not just nursing experience, but experience, with MDs, DOs in that, in a different environment.
Awesome. Telemedicine JNAB. I'm asking on behalf of my son, junior pre-med, will there be Dr. A's Application Academy this year? There will be. So stay tuned. Next month, we will open Application Academy again for students who will be starting or applying next cycle. So Application Academy is probably one of the best things that we've ever done at Medical School HQ. Students love it. Provides tons of great exposure to all of the different advisors on our team at a fraction of the cost of one-on-one advising. Group advising is not for everyone, but it is definitely something that is super valuable for those who go through it.
Mm-hmm. Yeah, just
Anything
a quick
to add
note.
to that, Rachel?
Oh yeah, just there is a wait list now. So if you go to applicationacademy.com, you can sign up for the wait list, and we'll make sure if you're on it that you get an announcement. We are planning on opening registration briefly in September. So it will not be, there'll be some specific enrollment windows that we're allowing, and the first one for next cycle will be September. So you can either just make sure you're on our email list, go get on it now by joining the Application Academy list at applicationacademy.com.
Trey, what is the best way to prepare for an MMI interview? I love this question because though my answer may differ from other people's answers, I would love to hear, Dina, Rachel, your thoughts. My answer is you're preparing for an MMI every single day, right? You are walking into situations every single day in your life and going, okay, let me process what's happening right now. There is a line to get the food. Okay, where do I start in the line? Uh-oh, someone's getting angry. Should I leave? Should I stay? Should I whip out my phone and record it for TikTok? Right? What you're processing information all the time, going, what do I do now? What do I do now? What do I do now? And so my tip for the best way to prepare for an MMI is treat it like real life. What would you do if you were in this situation in real life? And when we're in Application Academy, or when we're doing one-on-one mock interviews, doing one-on-one MMI prep, which again, we're having our biggest interview sale going on right now. And we do MMI interviews, mock interviews. When I tell students, what would you do in real life? All of a sudden you can just see their face relax, their shoulders relax. And they're like, oh my gosh, that's so much easier than me trying to figure out the STAR method and remembering, okay, situation, what's the T stand for? I forget. Oh no, I'm freaking out. Just treat it like real life. It's so much easier. Yeah. Dina, Rachel, you have any thoughts there?
Yeah, I mean, I participated in, facilitating our MMI days at Stanford. And I agree with Ryan. Like, you encounter those situations every single day of your life. I think logistically, just, go, if you do get invited for an interview and it's MMI format, just make sure that you know how things are going to work. If they say, we'll give you a question and you'll have 2 minutes to think about it and then 6 minutes to answer, just keep that time frame in mind, that you're not going to get to ramble on for 15 minutes. If you'd like to practice that, just timing answers for things. But I agree with Ryan. You encounter situations every single day. And other things like in the interviews, just make sure basic things like, you're looking at the camera and, you're still engaging.
Yep.
Oh, it's super late. Before we answer this question, mappedcon.com, our first live and in-person conference is happening October 6th through 8th. If you can make it to Baltimore, Maryland, October 6th through 8th, and you want to interact with our team, we'll all be there. If you want to interact with medical schools, with test prep companies, with SMP programs, post-bac programs, the Army's going to be there. We're going to have suturing workshops, CPR workshops. We're going to be doing headshots for your applications. We have so much stuff going on. If you can make it, leave a comment right now on YouTube and let us know why you would like to have a free ticket, what you would gain by going to MappedCon, and we'll look through some of those responses and hopefully give away some tickets.
Yeah.
And to Trey's question, we will be having mock MMIs at MappedCon.
We will.
Unfortunately,
it's full.
Yeah, I was going to say, I think it's already all sold out.
Sorry.
We are doing one-on-one advising sessions that could be advising or interview prep, and we do still have some spaces for those, and those are at a discount for MappedCon attendees. But yeah, I think the MMI is full. But we'll do more MMI workshops. Lots of MMI practice. I think, Alexis, if you're ready, we can take the next question, whichever one you had before. There you go.
Jemima, what is the best way to answer YDO without bringing MD down? Also, what is the best way to answer tell me about yourself during interviews? All right, so kind of two questions in one. Jemima, again, we're having a big mock interview sale. Would love to help you with mock interviews so you can practice this with us. Rachel, this comes up all the time. Courtney talks about this, again, former director of admissions at a DO school.
Right.
It's very common for students to bring down quote unquote allopathic medicine to answer why DO. What is your response here?
Yeah. So number one is do your research, right? I could rattle off a bunch of answers right now. What I don't want is I don't know why I'm having trouble with cameras. Sorry, Dina. There I am.
Okay.
I could rattle off a bunch of answers. I don't want to ever take notes and go, I'll just say what Rachel said, because my YDO might be different than your DO. Something we've heard Courtney, one of our fellow advisors, who's, as Ryan said, former director of admissions at an osteopathic school, say is that she got very fatigued of buzzword answers that didn't show reflection. So if your default is one more tool in the toolbox for OMM, try harder, learn more about OMM. And kind of to your point, Jemima, about not wanting to bring MD down, it sounds like you're already hoping to avoid this, but you don't want to say, well, I plan to treat the whole patient, because are we saying that MDs don't treat the whole patient? I mean, I think most of them do want to do that. The curriculum for the two schools are very, very similar. It's just that DO students get 200 additional hours of anatomy. So go research the tenets of DO. It's available. You can easily Google AAAMC. You can Google DO tenets or osteopathic school tenets. You might be surprised what you find there, right? It tends to not say toolbox OMM. It tends to not talk about holistic. Man, people love that buzzword. Dig a little deeper. So that's my answer. Is the best way to answer YDO is go really research why DO schools exist, what their values were, and then that will help you respond, because you're going to have more information to respond to. So that's my answer for you. Instead of giving you an example, is to say you'll do better if you dig deep and actually come up with something sincere. Because you're probably not going to say, I heard GPA is easier, right? Because that's not a great answer. And also not always true. I don't know about tell yourself. Do we want to try to tackle that as well?
No, I think let's look at the MappedCon answers.
Okay.
If there are any. Hopefully there are.
One, yeah.
All right.
There's a few. I think there's a few.
All right.
3, I see.
Alexis, can you put some of them up for us?
Michaela would love to go to MapsCon. I live right outside of Baltimore and may post back applying to med school next cycle. Awesome. You would be fantastic to go to MapsCon. Let's see. Who else we got? Little KJ in 1999. MapsCon would be awesome. I work at the University of Maryland School of Medicine in Baltimore, so it'd be no problem for me to attend. I would also be able to meet all of you lovely people.
Yeah, you're like a couple blocks away, little KJ. Let's definitely meet you.
Yeah. Tell all your friends too. Yes. All right.
I think I saw at least one more. Jawad, maybe? Yeah.
Jawad, I'd really love to come as I live 1 hour away. As a longtime fan, it would be an honor to meet you all in person. Jawad, love to meet you. Jawad is here most weeks asking wonderful questions. Michaela, Jawad, and KJ, little KJ, whatever that other one was. Email us info@mapped.com and let us know that we picked you from our pre-med office hours, and we will get you free tickets to MapsCon. Tell all of your friends as school is starting back up. We want this to be the best conference ever for pre-meds.
Yep.
And it already is because we're going to be there, but
You're gonna meet the great Dr. Ryan Gray. He's so humble.
It's a little narcissistic.
You actually are pretty humble. You just like to joke.
I joke. I kid. Awesome, my friends. Pre-med office hours coming to a close. We are here almost every single Wednesday at 1 p.m. Eastern. And I am typically live on Instagram as well, solo on Fridays at 11 a.m. Eastern. And the first Friday, typically of every month, I'm usually with Blueprint MCAT, and we're giving away some MCAT courses on that Instagram Live. So come join us, listen to our podcasts, come to MapsCon, hang out with us. We're here to help you. Have a wonderful day.